January is Thyroid Awareness Month, and while thyroid disorders can affect people of any age, they are more common in women. So here to share her insights so we can better monitor our thyroid health is Dr. Nira Madisi, an Albany Med Endocrinologist. Dr. Madisi, thank you so much for coming back.
Thank you for having me.
Always good to have you here. So we talked about women being affected more than men, and I know we don't know why that is, but the American Thyroid Association says women are 5 to 8 times more likely to have these thyroid disorders than men. What are the types of disorders that you typically see in your patients?
Sure. So you can have an underactive thyroid, which is hypothyroidism. You can have an overactive thyroid, which is hyperthyroidism. You can have little lumps and bumps in your thyroid called thyroid nodules, similar to if you were to develop a breast lump. The majority of the nodules are benign. So those are some of the, those are some of the more common thyroid problems we see patients for in our clinic.
And cancer is a factor too sometimes.
That's correct.
Yeah.
So we also see patients who have thyroid cancer, but thyroid cancer is rarer than the first 3 that I mentioned.
Yes.
But yes, we do see that.
So we have some symptoms that I'd love to put on the screen for everybody at home so they can just get a sense of them. But let's talk about that, and also what you've shared with me is that unfortunately, if you look at them, they're similar to symptoms you'd see in a lot of other conditions. But what are some of the general symptoms that you're seeing?
Sure. So if you have an underactive thyroid, you could experience a weight gain of about 10 pounds, usually not more than that. You can experience fatigue, hair loss, brittle nails, heavier periods, depression. So there are a lot of symptoms that you could experience from an underactive thyroid. And then the overactive thyroid, you could have unintentional weight loss, heat intolerance, lighter periods, or you just skip your period, irritability. You could get weakness of your shoulder muscles and hip muscles.
Wow, that's the gamut. So how do you get to the bottom of it?
You need to do blood tests because there's so many symptoms that overlap with other things. And so the blood tests really help us truly diagnose whether you do have an underactive or overactive thyroid.
And from there, the treatment is generally, at least for the hyper and hypo, is medicine, right?
With hypo, the treatment is usually medication. With hyper, you have medication as an option, and then there's also surgery and something called radioactive iodine ablation. So those are the options.
With regard to the surgery for hyperparathyroidism, is it removing some of the parathyroids, or what is it?
So hyperthyroidism is you can remove the entire gland if the whole gland is overactive in a condition called Graves' disease. Sometimes you could have a nodule, which is a little lump in the thyroid that's producing too much thyroid hormone, and in that case you just remove the half of the thyroid that has the lump. And then if you didn't like those options, there's a pill that you could take that can help.
Let's talk about medicine, because you brought something to my attention that even folks who are being treated sometimes don't realize they're taking their medicine incorrectly. So what should we be doing here if we're affected and we're on medicine for thyroid disease?
Sure. So quite often in clinic we get referred patients whose thyroid function is all over the place, and they've been taking the medication in a way that they think is the way they should for many years, and it's still not well controlled. So I always go over the right way to take it, and that is you're supposed to take it first thing in the morning, all by itself, with at least 4 ounces of water, which is half a glass. And then you have to wait half an hour before you eat or drink anything, including your other medications. And if you take calcium, magnesium, or iron supplements or vitamins, you have to wait 4 hours before you take those. And so I always ask my patients, hey, do you get up at night to use the bathroom? And if they do, I say, you know what, you should take your thyroid medicine at that time. Because then when you wake up, you can just get on with your day. Because a lot of people like to drink coffee in the morning, you know?
So you need to take it with nothing else.
Nothing.
So in the middle of the night even might be better.
That's right. If you get up at night. I don't like them to set an alarm for that. But.
Real quick, just special populations too. So if you're pregnant, if you've had a weight change, or if you're a child, right, and you continue to grow, you got to keep working on that medicine and the dose.
That's correct. So the dose is proportional to your weight. And so the more you weigh, the more you need. And the less you weigh, the less you need. If you become pregnant, you need to provide thyroid hormone for a growing baby. And so then you need a little bit of a dose increase as well. So those are some of the special populations.
Dr. Madisi, appreciate all the information, great insight, and such good tips with regard to when to take that medicine. Thanks so much for coming in. We appreciate you as always.
Thank you.
Remember, for more resources and to find all of our Women's Health Wednesday segments online, just go to news10.com, look for Women's Health under the Community tab. We'll be